Welcome back to the Asthma Education Home Study course with the lung coach, me. My name is Brian, and today's lesson I'm going to be talking about bronchodilators. Bronchodilators are the #1 medication used to treat asthma attacks and symptoms. If you come see me at the hospital with an asthma attack, my #1 drug of choice is going to be Albuterol. This is a rescue medication or a quick-acting beta-2 agonist. Now, I'm not going to go too in depth on that term, but basically what this means is this is your rescue medication acting quickly to open up your airways. Just like the name says, bronchodilator, it dilates the bronchial airways. Those are the bigger airways, the smaller airways, the bronchi and the bronchioles in the lungs. So, this is a wonderful medication in the treatment of asthma. It's saved many, many lives. If you have Albuterol, you might have it in a brand name known as ProAir, Ventolin, or Provental, are 3 brand names for Albuterol. And this is your little puffer inhaler that you take, or it may be in a nebulizer that you put into a nebulizer and breathe in and out for a few minutes. One note on Albuterol, it is very safe to use. However, it does have some slight side effects. It can increase your heart rate. It can cause your heart to palpate or race. It can give you a little bit of tremors. This is a stimulant, and the way Albuterol works is it stimulates the body, similar to your fight and flight response. Maybe you've heard of the sympathetic nervous system or the fight or flight response. Albuterol stimulates those types of receptors in your lungs to help open the airways up and get ready to fight or flight is our body's natural response. And that is so important in asthma attacks because as you get an asthma attack, that airway clamps down, that bronchoconstriction, and Albuterol helps open it up. And this is actually one of the identifying factors of asthma. This reversibility of that airway constriction. So, Albuterol, #1 drug of choice in the treatment of asthma, especially with asthma attacks. Another drug you may hear your doctor talk about is he probably won't say Anticholinergics. He will use the brand name Atrovent. Atrovent is another bronchodilator. It's not as effective as Albuterol. Some doctors do like to use it in addition to Albuterol in certain medications like a duo neb or 2 nebs into 1. There is also Combivent, which is an inhaler that you twist and it sends a little mist and you inhale that. That might be another type of inhaler your doctor prescribes for you. And we talked about methylxanthines. I shortened the word here. It's xanthines here. Theophylline is another one they may use to treat your asthma, although this is a lot older. They don't use this very often in treatment of asthma symptoms anymore because it can have more severe side effects than Albuterol, make your heart race, make you nauseous. It can get toxic, so they have to monitor it in your blood levels. Another thing that we want to maybe talk about with bronchodilators is long-lasting. These are short-acting or quick-acting bronchodilators. There are some other drugs that I'm not going to go into here called long-acting bronchodilators. They are usually in combination with inhaled corticosteroids. We talked about that in the anti-inflammatory medication lesson. They do this because long-lasting bronchodilators, a lot of physicians want to put those together with steroids to make the most effective medication, and there are some side effects with long-lasting bronchodilators that can actually put your asthma at more risk. So they like to combo these drugs. You might see these drugs like Advair or Dulera are combination drugs, and they use the anti-inflammatory and the bronchodilators together synergistically to help treat persistent asthma. Now, if you have mild intermittent asthma, you may only use Albuterol. That may be the only drug you use as a rescue inhaler. But as your asthma gets more severe and persistent, your physician may add anticholinergics like Atrovent or xanthines like theophylline. more likely they'll give you a long-lasting bronchodilator. One of these is Spiriva. Spiriva is a long-lasting Atrovent actually, so you may see that as an addition to your Albuterol in the treatment of your asthma. But Albuterol, that's your rescue. You want to have that. It acts within 2 minutes to help with your asthma symptoms. So it's your rescue. When you're having an asthma attack, please treat with your Albuterol. And if you have exercise-induced asthma, you may treat 5 to 10 minutes before you exercise with Albuterol using your inhaler. So these are the medications that we primarily use in the treatment of asthma, bronchodilators. So Albuterol, get a prescription if you don't have it. It's very important. It can help save your life. I've seen it happen many times with asthma attacks. So, as a matter of fact, if you come into the emergency, we'll give you a really big dose of this sometimes. So, anyway, that is our medications section of the asthma education program. I will see you on the next lesson, the final lesson, peak flows. Peak flows and peak flow meters and learning your peak flow, basically how to use it. So join me on the next lesson. I'll see you then.